Some people have said in the past that locum tenens is a last resort, might have an unpredictable schedule. What I've found, in the last 7 years working with locums, that a lot of our locums are career locums, and they have the ability to create their own schedule. For instance, some years they might want to work 6 months, other years they might want to end up working 10 months, so they have the ability to create that schedule well in advance, usually going into a calendar year. Such locum might consider themselves, okay, this year I'm going to work 9 months, and they have the ability to plan each year in advance to get to their set schedule they're looking to work each year. Locums, physicians, nurse practitioners, dentists, they can think that with locum tenens come a lot of paperwork. You're going to get credentialed at 3 facilities each year, 4 facilities each year. But actually, we've done a good job at Barton Associates in centralizing that process to where if we have an assignment for you at a hospital, if we've worked with you in the past or if you send your documents to us, we can actually track down those verifications, which allows you to practice on your locum assignment, worry about seeing patients while Barton Associates might reach out to an HR department or a credentialing department at a hospital you worked at 5 years ago to get those verifications over to your next hospital. So an agency can actually be a great resource for a medical professional. There's the idea that if you have a lot of locums on your CV, that some hospitals might look at your CV as you have some gaps, or it's going to negatively affect that CV of yours. But it can also show the idea of practice in multiple settings, maybe a rural area hospital, maybe a big health system in a city. It can actually help build a resume to where you can be well versed in many different settings with many patient demographics. Years ago when I started at Barton Associates, I thought that locum tenens was vacation coverage, gaps in schedule, but being here for 7 years now, I've figured out that a lot of health systems, rural area hospitals, what they'll do is they'll use locums to basically support their staff. They'll bring locums on for 6 months while they're recruiting a permanent physician. This will allow their patients to consistently go to their hospital over another hospital, maintain that patient volume for the time when a permanent physician does sign on. They don't have to go build a patient panel or patient volume. That's already been established through the maintenance of a locum doctor for 6 months.